there and welcome to Jordan Pilates. Unfortunately, I've got some mic issues, so I'm going to try and talk very loudly so you can hear. This class that we're doing today is a little bit different. It's really focused on back injuries, and we're going to do a rehabilitation video today. So if you've got really severe back pain or if you're really struggling with the tight back, this is a good class for you. Remember always to listen to your body. Any sharp shooting pain, you stop immediately and you consult your doctor or your healthcare provider. Okay, so to start off with all our usual videos, we begin with a pelvic curl or a pelvic lift. I've got my little towel underneath my head just to elevate my neck, and so I've got a neutral neck because I know I have a tight neck. So starting from the head down, I want you to tuck your chin down. Think about those shoulder blades, tuck them underneath your back. Pull your fingertips down towards your feet. Pull your feet in towards your bum. Close your feet. Now open your feet slightly and the heels slightly. In this position here, I'm thinking about engaging my core. Remember in the first video we spoke about neutral pelvis. I'm not going to go through that again, but I want you to keep a neutral pelvis. So you've got that little bit of daylight underneath your back. We're going to give a deep inhale. And as you exhale, we flatten the lower back. And just pull that belly button in. Thinking about that neck. So as I move my pelvis, I can feel my neck tightening. So in that position, you need to try and pull your neck back into neutral, tightening through the abdominals. And we inhale, exhale, release the pelvis back to neutral. Let's go for another 2 of those. We inhale, exhale, flattening the lower back, pulling that tummy in. Remember, we're trying to stretch out the back. So the more the abdominals are working, the more these back muscles can stretch out as well. And again, we inhale, exhale, release back to neutral. And inhale, last one on that one. Inhale, exhale, flattening the lower back. Pull it, tummy nice and tight. Hold that there. And now we're going to lift our bum ever so slightly. So as you can see, I'm just off the ground. In this position, I'm trying to thinking about my belly button pulled in, and I want my back to relax. I want my back to hang heavy because I'm trying to stretch out all these muscles in my lower back. And again, we inhale and exhale slowly down and release that pelvis back to neutral. 2 more like that. We inhale, exhale, flattening the lower back and pulling that tummy in. Keep that chin tucked down, the bum lifts ever so slightly, let the back hang. We inhale and exhale, flatten and release back to neutral. Last one like that. We inhale, exhale, flattening the lower back, putting that tummy in nice and tight. I'm slightly off the ground. Now we're going a little bit higher. So I'm going to about there. So I'm halfway up the back. I can almost feel where it's my bra straps, the last thing on the mat. So it's halfway there. Thinking about my abdominals really pulling in. Excuse me. I want to really tuck my pelvis in this point. Trying to scoop through my pelvis because I want my back to stretch out. So the more I do so, I'm going to feel that lovely stretch across my quads. Pulling in as tight as I can here. So in terms of those bony landmarks, your pubic symphysis is really coming around now because we're pulling that pelvis around. And then as I inhale, I'm thinking about that back just hanging. As I exhale, I slowly come down little bit by little bit, thinking about those abdominals still pushing down. They're the main movers. They're moving you down. And we relax back onto the mat. We inhale and exhale, flattening the lower back. The abdominals tight. Chin tucked down, shoulder blades flat, and we're coming up halfway up the spine. And now I want you again to think about, we're going to inhale, we're going to stay up this time. Inhale. And as you exhale, I want that breath to kind of pass through and just go into your back. I want your back to just relax through that. And again, I'm scooping through that pelvis. I'm holding that tight. I can really feel a lovely stretch through my quads. And I want you to inhale here again. And exhale, these abdominals are pushing down, the next, and eventually the pelvis comes down and we rock that pelvis back to neutral. We're not overcorrecting, we're just at neutral, where those 3 bony landmarks are on a flat surface. And again, we inhale, Exhale, flattening the lower back and coming up to halfway, and now we're going to go all the way to a full pelvic tilt. Full pelvic tilt. I'm not just letting my back hang, I'm not pushing my bum out, I'm keeping everything tucked in. I want that pelvis to be scooping still, because that's the main idea, to stretch that lower back. So I want my pelvis to tuck in, I want my abdominals to, again, they stay tight the entire time we're doing this exercise. I want my pelvis also not wobbling around, I want it stable, so I'm asking all my muscles to keep me still. Your glutes at this point, your bum is going to be fighting with you and saying, I'm holding for too long. But we want them to work because we need them to be working, and they're also supporting muscles. So give them a good squeeze whilst you're up here. We're going to inhale. Now the abdominals from here, we're thinking about coming down. Again, I'm scooping through my pelvis, and I'm slowly, chain effect, coming down one vertebra at a time. Release the pelvis back to neutral. Deep inhale, give that lateral breath, open up that rib cage. Inhale, and as you exhale, you're flattening the lower back, putting that tummy in tight, and let's climb up one vertebra at a time. One at a time. Articulate through that spine. And at the top, I hold. I'm thinking about my rib cage holding tight, my abdominals are holding tight, my pelvis is scooping, my quads are stretching, my glutes are supporting. Open up that chest for me. Think about long collarbones at the top here. We inhale and exhale. And again, we're trying to stretch out our spine. So when you're doing this, I want you to really emphasize, think about this vertebra is pushing onto the mat. And the next vertebra is pushing onto the mat. The next vertebra is pushing onto the mat. Imprint your spine down to the mat little bit by little bit. And we come back to neutral. Now what you can do for me is you can pull one knee in toward your chest. Lengthen the other leg, and I want you again to think about, we're still holding that stomach in, and gently pull that leg down as it releases. And if you're doing this video at home, you're welcome to hit pause, and you can just enjoy the stretch. If your back is really tight and really sore, you're going to have to stretch a little bit longer. So you're welcome to hold these stretches for a good minute. It will do you a world of good. Hold that leg in, gently put that heel down, bring the other leg up, and lengthen the other leg. And again, we pull that leg in, stretching out that lower back. So this video is going to be a combination of working and strengthening, but you're going to see it's going to be a theme of also really stretching through the back as we go. And again, pull that knee in. As you feel the muscles loosen up, pull that leg in. Now gently bring the other leg back to you and get both legs towards your spine, not your chest. And we're stretching out. Now again, this part you may want to pause and just hold this position, depending on how much pain you're in. And again, we want to just let the blood flow through, because when we stretch through a position, because what we're seeing here is we're creating a long line. I want you to think about all these muscles going right around are being stretched. The moment we lift our head, we're stretching even further. And the longer you hold that, the more blood flow, the more oxygen, minerals and nutrients are getting through all those muscle parts. So now I want you to inhale for me. As you exhale, tuck your chin down. And if you're able to, you're going to try and tuck your forehead onto your knees. If you can. If you can't, it's no problem. Just come up as high as you can and squeeze those knees in toward your chest. And now I'm sure you can see you created a very long line. You're creating a big chain effect of a stretch. Hold that for a few more seconds. We inhale. Exhale. One leg comes down and the other leg comes down. Good. The next thing we're going to do is a chest lift. Chest lift is hands behind the head. We've done this before in the other videos. Thumbs in the nape of your neck. I want you again to pull your legs into an angled position. You should have a fist between your knees. Give me a deep inhale. As you exhale, tuck the chin in. Exhale, lift through the chest. And when you're here, belly button pulls down. Inhale, give me a little bit more height. And then exhale slowly down. And then again we inhale. Exhale, tuck the chin. lift through the chest. I want those elbows to stay nice and wide. I want you to pretend there's a rope here and someone's pulling your rib cage up. I want you to feel as if that's lifting off the mat. You're not going to, and I don't want you to lift up more than that. It's just a slight movement here. Stability in the pelvis and the rest of the body. Inhale, come up a little bit more. And exhale, slowly down. And again, we inhale. Exhale. Tuck the chin, lift through the chest. Inhale, give me a bit more. Pull that belly button down for me. And exhale as if you're deflating. Coming down. Deep inhale. Give me that lateral breath. Open up that rib cage. And as you exhale, tuck the chin in towards your chest. Lift through the head and the chest. Coming up, thinking about that rope is pulling you up. Inhale, that rope pulls you a little bit more up. Elbows are nice and wide. Head tucked in. And exhale, slowly down. Let's do 2 more. We inhale. Exhale, tuck through the chin. Lift through the chest. Inhale, come up a little bit more. Belly button pulling in, nice and stable. And exhale, slowly down. On the last one, we're going to hold because we're going to add rotation. Inhale. And exhale, tuck through the chest, lifting through and hold. Now, if your lower back is exceptionally tight, now normally we do this exercise in a neutral pelvis, but if you are exceptionally tight, this whole exercise, I want you to flatten the back. And this may be true for you now. Maybe you've got to this point and your back is starting to light up and it's starting to shout at you. I need you then to flatten your lower back and just hold that in for me until we get that back nice and stretched and we get you strong. But for now, if you're able to, you keep that neutral. We're lifted, our arms are still wide. We're going to exhale and we're going to rotate. Now, this should not affect your lower back because we're not actually even moving into your lower back. We're moving the upper body here. And we exhale and we rotate. Inhale, center. It's a nice slow movement. Exhale, rotate. Try and think about this shoulder blade is lifting off the mat. And we inhale, center. Exhale, rotate. And this shoulder blade has come off now. And we inhale, center. Exhale, rotate. Make sure your chin is not cheating. So your chin's not trying to, make sure you're not lifting through your chin. Keep your chin tucked in. Inhale, center. Exhale, rotate. Thinking about your obliques are moving you. This part of your body is moving. This side is contracting. We inhale, center. Exhale, rotate. This side is stretching out and trying to rotate you in. This side is contracting. Inhale, center. 1 more on each side. Exhale, rotate. And inhale, center. Exhale, rotate. Inhale, center, and slowly down. Arms overhead. And you can lengthen your legs down one at a time. Giving a deep inhale. And exhale. And just relax. Right, we're going into the next exercise, which is spine twist, and we're going to do it with a modification. So again, this is for people with sore backs, and I want you to take good precaution here because we are loading the lower abdominals. So if you are very weak on your lower abdominals, you're going to be doing this. You're going to lift one leg up at a time, and you're going to keep your knees tucked in. If you have no strength, if you are just sore and you want to get moving, I want you to keep your legs here, and this is for really, really sore backs, and it's such a slight movement. You're rocking from side to side. You're just trying to create a little bit of movement in that lower back, because that movement's going to bring blood, and and the blood brings all the oxygen and the minerals and nutrients which help open up and help alleviate pain. So for the moment, if you're really sore, you're just going to live here. If you're not really feeling it, but you have got a bad back, I want you to open up your arms to a T. Now, your knees can stay in that position if you want. So I'm going to take you from the easiest to the more challenging. And then you're going to, again, rock from side to side. So we've taken away the aid of the arm. Now you have to use your legs and control them, keeping them as close to your chest as you can, and again, rocking from side to side. Now in this position, maybe that's what you're able to do, but now you can actually go a little bit further. And we're getting a little bit more movement. and maybe you're able to. But the key here is shoulder blades stay on the ground. There's no point in you kind of rocking around and the whole body is unstable. I want you to just give me a little bit of movement, shoulder blades still on the ground, little bit of movement, shoulder blades still on the ground. Then if we're getting into harder, it's still not the full exercise, but it's a great way of getting a little bit of movement in the lower back. We're loading the lower abdominals, so depending on where you're at, you're going to take that part which suits you best, and you're just going to give me a little movement there and a little movement here from side to side, and 2 more on each side. Now feel those lower abdominals, legs are in a tabletop position, pulling into my abdominals nicely. Last one here. Bring it center, one leg down, other leg down. Good. Okay, so we are on to our leg lifts. So again, depending on your pain level, if you're in a lot of pain, you're welcome to gently bring your leg up, put it down, and just aid yourself. Otherwise, arms out to a T, and leg is tabletop, and you're going to tip the ground and gently lift. 1 and 2 and 3 and 4 and 5 and 6. Give me another pointed toe. Let's put that leg down, and 1 and 2 and 3 and 4, 5, and last one here, 6. And that's where you're stopping for now, because if you've got a really bad back, you're not going to go into leg changes just yet. We're going to get you strong, get those lower abdominals working, and alleviate the back pain before you go into leg changes. Remember, if you are very weak here, you don't want to load the legs. If your abdominals are not holding, your back's going to start reacting and take over, and you don't want that. Okay, so we're going to go into 100 prep again. This is all building abdominal strength so we can alleviate the back pressure. If your back is really lighting up and you're very, very sore, I want your back to be flat, you're out of neutral. If you are okay and you can handle neutral position, that's obviously ideal, because these muscles are working to hold you securely. If you're able to do neutral, please stay neutral. Arms overhead, palms are facing the ceiling. We're just going to inhale and hold here. Belly button pulls down again, and exhale. Easy breath pattern. We inhale up, tuck the chin down as much as you can. Remember, if your neck is starting to get really sore, tuck your chin down as much as you can to just alleviate, and don't lift through your neck. Exhale down, and again inhale up, and exhale down. Inhale and exhale. Inhale up and exhale down. And give me 2 more. Inhale up and exhale down. And inhale up and exhale down. Right, I'm going to show you the easy version of a roll up. I'm going to show you if you are really struggling with a roll up as well. So you're going to pull your legs in for me. Put your hands underneath your knees. Tuck the head and chin up. Lift through the chest. And you're going to throw your legs ever so slightly. But I want you to use your abdominals to get you up. Lengthen through the legs. We're rounding over those legs. We inhale. And exhale. Gently bring your legs up again for me. And gently rounding into your back, and slowly and gently put your head down. Inhale, exhale, tuck the chin, lift through the chest, use your legs as a lever, as momentum. Use your legs to kind of throw you up, but obviously not throw with any force. I don't want you flying, I want you to just gently coming up, Extend those legs. Give me a C curve. So we're stretching out the back, we're stretching over those legs. Gently bend the legs again. And again, make yourself as tiny as you can. Gently down. Extend the head back onto the mat. So we inhale. Exhale. Tuck the head and chest up. And use those legs to pull you up. And extend over. Inhale. Gently. Can you see I'm doing it so slowly? I'm not throwing my body. I'm not at my body's whim. I am using my muscles to gently put me down. I'm using my muscles to gently get me up. That's the idea of the roll up. We want to gently, it's all about gentle strengthening. It's not about just throwing yourself around and using momentum. So when I'm here, I gently extend my legs. And when my legs are pushing forward, it gently brings everything else. But I'm also going to use my abdominals. My abdominals are also helping me climb up. So when you're at the top again, remember we're going to do that C curve. We inhale, exhale, bring those legs back to you, and together, going down evenly over your back. Bring those legs in, put your head down, look left, look right, shake out your neck a little bit, and we've done that one. In this position, stay as you are, because we're going to keep holding on to those legs. Underneath, and hold underneath, because again, we're going for a very sore back. When it's a sore back, we want to try and keep it flat, but we want to strengthen it at the same time. Put your hand underneath your knee, extend one leg. When you're here, give me quad. I want you to push your foot away, get rid of your foot. So push up your foot as far away, and you'll feel your knee will extend, your leg is strong, and then you gently bring it back and change sides. Extend. Now what I want you to do, I want you to think, oh, are my toes in line? If I had to put a ruler on my toes, would they be in line? Push your foot away and gently bring it back. Head and chest are lifted. If your neck is really taking strain here, you're welcome to lie down, shake it out, tuck your head and chin up and lift again. And extend. And bring it in. And if you need a breathing pattern, it's feeling stronger, you're welcome to send those legs further away from you. And if you're feeling strongest, you're not holding those legs at all. Bring those legs in and gently lie down. Shake your head left and right a few times. Just give that neck a little bit of a break. Okay. In this position here, one leg is long, and gently I want you to extend the one leg to the ceiling, and I want you to hold underneath your calf and a very gentle pull, pull. Now slowly place that leg down, bring the other leg up, extend the other leg, and gentle pull, pull. Put that foot down, bring that leg up. There's a reason we're doing it this slow, is because we don't want to upset the lower back, but we also do want to stretch your hamstrings. And pull, pull, and down, and pull, pull. One more on each side. And again, if your head and chest, if your neck's getting really uncomfortable in this position, you can look down, pull, pull, gently down. Give me a lovely stretch. Pull your tummy in as tight as you can. Look left, look right. Arms overhead, fingertips pulling, toes pulling. Extend everything. We inhale, exhale, and just drop your arms and your legs and just relax. And again, we extend, 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 extend. Inhale and exhale. One more like that. Stretch, stretch, stretch. Pull your tummy in for me. Pull your tummy in as tight as you can, but you're stretching everything else. And inhale. And exhale, extend, and drop. I want your arms out to a T. Bring your legs up as high as you can and gently let them fall to one side. Now, if you have got if your back is very, very sore, you're welcome to use a ball, and you put the ball underneath your knees and you gently let your legs rest on the knees in this position. But if you're able to get your legs down in this position, you're welcome to just relax and give me a deep inhale and exhale, and inhale and exhale. And I want you just to let your body just relax into this movement. Inhale, we're going to change sides. Exhale, and legs fall to one side. Remember, if you need that aid of the ball, I will do a ball video soon. So I'll show you a few tricks that you can do just to alleviate as well. And again, inhale and exhale. Inhale and exhale. Last one here. And exhale. Bring those legs up for me. Bring your knees towards your chest and just let that lower back stretch out here. And again, gentle movements just from side to side. So we're getting a little bit of blood and oxygen into that area. Just gently putting those knees tighter because we get a deeper stretch, which is what we want. If you're able to, again, tuck your forehead onto your knees if you're able to. And hands underneath your legs, you're going to gently extend your body up. And sit up nice and tall. In this position here, I want you to cross your legs and sit comfortably. And I want you to slowly look around. You're not going to put your head straight up to the ceiling, but you're gently going to sit up tall. And I'm just at a couple of degree angles looking up, down and around, and the other way around. One more on each side. Your legs ever so slightly forward, and I want you to gently pull your body just slightly forward. And I want you to just hang in this position. Let the body just relax over your body. You're going to feel a very big stretch down your legs, but that's fine. Inhale for me. Sit up nice and tall. In this position, I want you to gently pull your head down, relax the opposite shoulder. Inhale. Exhale. Look underneath your arm. Inhale. Exhale. Release. Look up, look center, and gently pull down. Inhale. And exhale. Look underneath your arm. Inhale. Exhale. Release. And obviously, you're always welcome to pause the video and have a look at those stretches a bit more detail. Finally, I want you to just pull your hands together and push outwards and sit up as tall as you can, and again round those arms, round the head around. Finally, push the hands away. Gently bend forward. With your legs crossed, pull as far forward as you can. And again, you're going to relax into this position. You inhale and exhale. Inhale and exhale. I'm just going to get you into the rest position. Rest position is either you can have your knees closed or you can open up your knees for better comfort, and you're going to pull, just put your bum onto your heels if you're able. If you aren't, a lot of people can't actually get their bum on their heels. So if you can't, you're just going to let the back relax like that. But if you're able to, get that bum onto the heels and just relax. Pull those arms as far forward as you can. And deep inhale and exhale. And inhale and push all that air out. Last one. And exhale. Coming up into a quadruped position. I want you to, you're going to do cat-cow. In this position here, the stomach is always engaged. I want you to be pulling into your stomach as much as humanly possible. When you're pushing out, I want you to pretend there's a big flashlight and you want that torch right here in the middle of your chest to flash diagonal. So I want you to think about your chest is moving forward when we go into the opposite position. And then when we tuck in, I want your tailbone to tuck in. So in a quadruped position, we're going to first tuck the tailbone and the rest of the spine reacts. And now inhale. And now we think about that torch pushing through, and the torch moves through our arms. And I'm still tucking in my stomach. I'm pulling my stomach in. I'm trying to think of my back like a rocket. The rocket's trying to come through. We inhale and exhale. Tuck the tailbone in. And push the torch on your chest. So push your chest through your arms. Tummy comes in. And I'm not using my neck. I'm not hyperextending through my neck either. I want my neck neutral. So when I'm here, I'm just looking a little bit ahead. And again, I tuck. Hold that position. And we bring the chest through. Lovely. Good job. All right. I hope you have enjoyed that. It's a express little quick class to just help alleviate that back pain, and hopefully you start feeling better really soon. And I'll see you for the next one soon. Thank you.